All right, so here's a quick and simple routine that we could do to help kind of reverse or correct sitting posture. So the goal is we're going to mobilize the hips and restore some symmetry through the pelvis and the rib cage, helping resolve some lower back pain as well. So what we're going to start off with is a half kneeling hip flexor stretch. I'm sure you've seen this one before, but if you haven't, let's go over all the cues. So we want 90-90 knee bend, so front knee at 90 degrees as well as the back knee. We don't want to be too narrow like this. We want to make sure we have some good coverage of our 90-90 position. We want this back thigh or your femur bone to be slightly angled behind the pelvis, right? So if we're up here, and you may only be able to get here, especially if that hip flexor is really tight. So we want that back hip to be, or the back leg to be behind the hip, not so much where you're feeling the arch in your back. So find that position where you can kind of feel a little stretch, but you're not too far where your low back is starting to arch. So we want to correct that position by tucking the tailbone or sort of engaging that back glute. So almost thinking of pushing your belt buckle or the front of your pelvis forward, feeling that glute firm up. That's correcting that low back curve. From there, you should automatically feel a little bit more of a stretch higher up into that front hip, your iliopsoas region there. And from here, what we're gonna do is you're gonna start by resting your hands on your thigh and just kind of gently rocking and pulsing forward and back. We also want to think about pulling our belly, our abdomen in, so we have tight button guts. So tension is no more than a 4 or 5 out of 10. So just kind of lightly bracing or pulling this section in to allow the best stretch in that hip. As we're here, we're breathing, and we're trying to get a little bit deeper over time. Again, watch out for the arching of the back. You want to stay straight spine, keep that tucked position. Shoulders back, head over spine. Taking some deep breaths into the diaphragm. We're going to get there in a little bit. And now let's do the other side. So we're going 2 minutes on each side. So again, 90-90 positions, trying to get this femur or this thigh bone behind your pelvis. Make sure that this front foot isn't too narrow. 90-90 bend, little tuck of the tailbone. So if my butt is out, I'm kind of curling it in, but not so much where it's slouching me forward. So shoulders are gonna stay back, heart is up. Watch out for the arch. Button guts remain, getting that 4 out of 10. Breathing, and a little bit of movement. So we're not doing a static hold here. We're trying to get a little bit of motion. Just think if you were sitting for a while, you're still as it is. So I like to add some movement to this. Helps the muscles and the fascia kind of unwind. Again, hands can rest on that front thigh. They can go on the hips, as long as we're staying upright with your posture. You can come back periodically and kind of work on, again, that tuck. Gently kind of squeezing that back glute, thrusting the pelvis forward. Over time, trying to work a little bit deeper into more hip extension, right? Just picture if you were walking and you may see older people with really tight hips over time, with a short stride and kind of hunch forward and having the tendency to trip over their feet. That comes a lot from the lack of hip extension, the lack of thigh bone going behind the pelvis, right? Which is what we're trying to do. Open up your stride. So when you're walking, you have a much more open gait, and it takes a lot less stress off the back and puts more of that onto the glutes and the hamstrings. The muscles we want working, not the back. Good. So once we've got both of those opened up, we're going to come down to our hook lying position. Supine. Supine is face up. Hook lying meaning on our back with our feet flat. We're going to go a little bit wider with our feet, about shoulder width apart, and we're going right into some windshield wipers. Now, you may feel like your shoulders are going to want to pop up off the ground here, especially if we've got really tight hips. I want you to bring your arms out to a T and only moving from the hips and the legs here. So as soon as you feel your back or your shoulder want to pop off the ground, that's far enough, even if it's just this to start. Think of like taking a little can of WD-40 to the hip sockets, which is a ball and socket joint, much like the shoulder, right? So hips need to rotate, and when we lose this rotation, what's going to take the brunt or the mobility of that is going to be either up or down. So it's either going to be our back or it could be our knees. So if you find that your hips are stiff and can't rotate very well, you probably have either knee or low back pain, or maybe both. So over time when I'm doing this, I'm trying to keep as much of my back glued to the ground as I can, not letting those shoulders pop up, but I can start to push a little bit. So as I'm going to one side, I'm reaching my knees, especially the inside of my knee down. Don't forget to breathe. Breathing is key. If you feel a little snap, crackle, pop going on, it's okay as long as it's not painful. Just waking things up, moving things around that haven't maybe been moved in a while. All right, so now we've gotten the hips moving. We're gonna get some stability now through our core. So this position, I could do an hour lecture on this, and I've done tons of other videos on it. For the sake of today's video, we're gonna keep it pretty brief. So it's all about connecting our core to the floor. And we do that by kind of anchoring in our lower back to the ground. So naturally right here, we have a bit of a lumbar curve, especially if our hips are tight. We may even have a bigger one. So smush that low back to the ground. Almost slide one of your hands under there and push that back down, almost like you're trying to smush your fingers. Keep that position. You'll notice that that kind of unweights your sacrum or your tailbone or like the top of your butt. Hands are going to be on the outside of the low rib cage. Now while you're here, I want you to ever so slightly just push your heels into the ground. Kind of dig them in, but toes are staying down, so don't lift your toes up. Feet stay flat, push your heels in, and again, root or anchor that low back into the ground. Now, what happens here very often and commonly is hamstrings may want to tense up or Charlie horse. That's a sign that those hamstrings haven't been used in a while, or that you've been sitting on them, they've been dormant, right? Kind of like poking an angry bear in hibernation. So if that happens, you can feel like that sharp pain in the hamstring, it's completely normal. Take it into a little bit of a sciatic nerve floss like this. Curl my toe and my ankle down, so see I'm dorsiflex, so I'm not here, I'm here. Take the foot off the gas, and then get a little bit of movement, trying to straighten that leg and knee, reaching the heel up towards that. So 10 or 15 or so, you can do that on both to kind of prime them, but if your hamstrings cramp up, go to that, and then come back to your hook lying position. Feet, again, glued into the ground, especially the heels. So points of contact would be heels, and then as well as the big toes. Okay, back anchor, little bit of a pelvic tilt here, so I'm thinking of bringing my belt buckle up towards my ribs and my ribs down. Right from here is where we're gonna apply that diaphragmatic breath. So your diaphragm is the muscle that sits below the lungs. We are trying to expand or inflate that area right here on the low ribs on the inhale. So you're breathing in, and out through the mouth. So inhale, smell the roses. Think of expanding your ribs at 360 degrees. Exhale through the mouth, like you're blowing out birthday candles. All while keeping that low back and lumbar glued to the ground. Again, I can just about almost slide my hands under my butt. I'm not in a full bridge, but my sacrum or my tailbone or the tops of my butt is off the ground. Keep going with that breath. Breathing in, breathing out, blowing out the birthday candles. Now you don't want to feel too much strain in the mouth, the jaw, or the neck with the exhale. So if you feel kind of tense up through here, try to relax those shoulders, drop them down a little bit. Maybe instead of the birthday candle exhale, try an open mouth sigh like this. If that helps. If you feel tension in the neck, jaw while doing the exhale, switch to the open mouth or the wide mouth sigh. The goal of the exhale is to try to draw back in your deep core. It's known as your TVA, your transverse abdominis. So I'm almost trying to pull the belly button up and in while keeping that lumbar back anchor glued to the ground. I'm breathing in, I'm feeling that inflation 360 degrees. I'm exhaling, I'm drawing everything back in. Try to go for at least 3 seconds in and then 3 seconds out, and then eventually working your way up to 5 and 5. In for 5, out for 5. Keeping those heels kind of into the ground. Again, 3 to 4 out of 10 effort on the heel. Drive into the ground. We're managing what's called intra-abdominal pressure here. So we're breathing in, almost like inflating a can, like a soda can. And as we exhale, we're deflating or sort of compressing that soda can, that cylinder, right? So picture the pelvis underneath the rib cage, kind of making that cylindrical shape. As we inhale, we're creating pressure around, almost like inflating a water wing or a floaty around our spine, bringing lots of stability around your back. And then as we exhale, we're really kind of pulling all the muscles around the back and the deep core together to keep that area strong. Good, so let's relax out of there, widen the feet just a little bit, and come back to those windshield wipers. We're kind of yin and yanging from stability and mobility. Stability from the core, and then mobility from the hips. So we'll return back, so feet about hip width or shoulder width, somewhere around that position there. Light back anchor here, hands back on the rib cage, again, shoulders are relaxed. Reconnect to your core, to your back anchor, a little bit of that pelvic tilt, but I'm pushing the low back down into the ground. So another benefit of this, not just physiologically restructuring pelvis and hips and helping decrease back pain, but it's almost like a little mini meditation. I'll explain why. We have our vagus nerve, which runs from our cranium kind of down, it passes through the trunk, deep in the trunk, through our diaphragm. So if you are someone who kind of goes through, a medium or high amount of stress and feel like you chest breathe, you feel tension in your shoulders, chances are that diaphragm hasn't been fully used and stretched through the breath. So what you can do, through this breathwork technique, you're actually stimulating that vagus nerve, which gets your body sort of out of fight or flight and brings it into more of a rest and digest or relaxation mode. So there is so many benefits of doing this hook line back anchor core breathing. If there's one exercise, if you're going to spend 5 minutes doing anything, I would highly encourage you to do this if you're experiencing back pain, stress, anxiety, just overall tightness or feeling off through the body. Down on the floor, connect to your core and breathe. Now, there's 2 more moves that we're going to do to kind of create that shield or that strength effect through our spine and our lumbar. The first one we're going to do is we come back, we come into that hook lying position, back anchor. We are thinking of peeling up one vertebrae at a time, starting with our sacrum, right, our tailbone, curling up, getting as much lumbar off the ground as we can. I have my arms down off to the sides here. I'm almost lightly pushing my palms through the floor. And again, I'm not coming up into a full bridge yet. It's all through the pelvis. It's a lot of hamstrings. You'll feel the glutes too. And then while we're here, again, we are just trying to maintain butt and gut position of being contracted while we incorporate that breath. So breathing in, feeling that expansion. And exhale, compressing back in. It's like an accordion. We're breathing in, we're breathing out. 360-degree expansion, trying to send that breath low, like pouring a glass of water slowly. If you pour that glass of water fast, the water's going to splash out, right? If you pour slowly, it's going to fill from the bottom up. And then we'll come back down, come back into those windshield wipers. Nice and relaxed here. So kind of, again, going back and forth, yin and yang from mobility and stability. And you may find that if you come back to those windshield wipers, you might gain a little bit more movement through those hips. Proximal stability through the deep core increases distal mobility, meaning we get stronger in the foundation of our body. That allows for greater potential mobility in the rest of our joints. Kind of like having a strong foundation of your house. If that's solid, the rest of the house is going to be pretty solid and efficient. All right, so we're going to come back to our back anchor position, gluing that low back to the ground, hook line, peeling up one vertebrae at a time. So again, first thing comes up is your tailbone, then the top of the sacrum, and then L5, L4, 3, and 2, maybe 1, and we're here. Heels are dug into the ground as well as big toes. Pinky toes, you can feel them, but most of the engagement of the pressure is on the heels. Now what I want you to do is bring more weight to one foot than the other, almost like you're attempting to lift the foot up off the ground, but I don't want it coming off the ground. It's like bringing 80% of the weight over to one side and then 80% of the weight over to the other side, so it's very subtle. Maybe your foot will just barely hover. The goal here is to feel this tension go from one hamstring or one glute, back of the leg, to the other. We're trying to stabilize the pelvis. So the pelvis, imagine like a bowl of water filled to the top. Don't spill a drop out the side. So when you bring that pressure to one side of the foot, don't let your hips tilt at all. Working on pelvic stability and motor control. Always remember, as I'm doing these cues, you're sticking with that breath. So you're breathing in and breathing out. Good, come back down. You should feel that kind of lighten up the hamstrings. Coming back to the windshield wipers. You can go a little slower with them, trying to reach the inside of the knee towards the floor while keeping, again, as much of the back glued to the ground as you can. The hamstrings feel like they need a little bit of a stretch out. You can give them that to them with that little nerve floss. And remember to keep the foot flexed back towards your shin. And so the last thing we're going to do today, this is already a longer video than I anticipated, but I'm very detail oriented. I like to give lots of cues, so hopefully they stick with you, is we're trying to create now real deep core engagement. So if when we first started here, when we were doing the exhale, if you couldn't really feel this kick on too much, that's completely normal. What we're going to do now is try to really make this deep front side or anterior portion of our core fire up. We just did our posterior, right? So posterior, backside, hamstrings, and glutes. Now we're moving into strong anterior activation. All right, so again, kind of relax the shoulders. Come back to your connect core position, low back glued to the ground. I'm unweighting my sacrum, belt buckle up, ribs are down. And now what you're gonna try to do is bring your feet up off the ground. You'll notice that if you just bring one, it's even challenging to do that. And then see if you can bring the other one up too. Now, getting into this kind of 90-degree position, almost like you're sitting in a chair that tipped over. you're gonna find that a lot of the weight is now back on your sacrum. You may feel like you lost a little bit of your back anchor. What I want you to try to do is to lift your sacrum or your tailbone, the top of your butt off the ground. You use your arms to do that. And come back to your breath. So again, I'm smushing my lumbar low back to the ground. I'm trying to lift my butt or my sacrum off the ground as I breathe. And you're gonna feel like your body is quivering here because this is tough stuff. We're waking up deep muscles in the core. As you exhale, try to lift that tailbone and the sacrum up off the ground, keeping the lumbar down. Breathing in, don't relax, don't come back and weight your butt back. Stay hooked, stay connected through your core. Breathing in, feel that global expansion, 360 degrees. Exhale. Really try to lengthen that exhale, a full exhale. Push every drop of air out, pulling the belly button in towards your ribs as you fully exhale. And rest as you need it. Good. Come back down to the windshield wipers. They feel so good to come off of that core activation. And we're gonna try one more round of that. You should be feeling that. Reconnect to your core back anchor. Tuck the tailbone. Try to lift those feet slowly. All right, my butt is kind of unweighted from the ground. I'm a little bit more than that 90 angle. That'll happen because I'm not too flexed at the lumbar here. I can even be here and lift up. That's even more subtle, but coming past 90 slightly will probably make it a little bit easier for you to achieve. But eventually, if you come to even just this strict 90 angle, see if you can then try to lift your butt up off the ground. Even harder, right? See how long you can hold it. Don't hold your breath though. Woo! Smoked. Back to your windshield wiper. You could do another full round of this sequence, starting back at the top through the half kneeling hip flexor stretches, or just kind of starting back through the hook line position, the bridge, and then the bridge kind of, I say march, but it's not really a march, it's kind of a weight transfer, and then back to this 90-90 core isometric. Gotta come up with a cooler name for it. All right, keep up with this practice. Give this a shot. Comment or reach out if you have any questions on this. I try to give you lots of details so you can own it and move better, feel stronger through the core. See you next time.